Welcome back. Separating the facts from the fiction surrounding the pandemic and the fear. We're continuing this new portion of the News at 9 where we bring viewer questions about COVID-19 to the experts. Tonight, we're once again speaking with Dr. Robert A. Frolichstein, an emergency room doctor working out of Methodist Hospital right here in San Antonio. Doctor, thank you for joining us again. I'd like to take you're one of the first responders out there. You're kind of on the front lines of this whole thing, and we appreciate that and all that you and the people you work with do. What are you seeing right now in the emergency rooms?
So we're starting to see a little bit of an uptick in the number of patients coming in with illness consistent with COVID, and several of them have tested positive. And certainly there are some that are coming in that are have a mild flu-like illness that either probably don't have COVID and thankfully, again, certainly they're not sick enough to need to be in the hospital. And so we're able to discharge those patients.
Today, we learned that soon anybody, or not anybody, but people with COVID-19 symptoms should be able to be tested in San Antonio. SA Metro Health is expected to loosen the testing criteria. How big of a problem has access to testing been in San Antonio, and what would wider testing mean to you, the medical community, and to our city?
Yeah, so I'm excited that it seems as though testing is going to become more widely available. For instance, just the example I just said, we've seen some patients in the emergency department that have symptoms consistent with COVID, that they're not sick enough to be admitted to the hospital. We send them home and say, we think you probably have that. It will be so nice that soon we'll be able to actually test them and say you do have it. It doesn't really change the outcome, right? They're still going to go home, but we know from prior studies and that people who know they have a diagnosis are much better at doing the quarantining that is so much more so important when a patient does go home with that illness. And the same thing in the community. When the more we test and the more we can say you have it or you don't have it, it helps us to better control the spread of the virus in the community.
Right, people change their behaviors.
Yes, yes.
Next question, do mosquitoes spread the coronavirus?
There's no indication that it is spread by mosquitoes at all. It's very, very unlikely that it's even blood-borne. It's really through saliva, and so mosquitoes would not do that.
Next question, are there over-the-counter medications that would help with the symptoms of COVID-19?
So COVID-19 is a viral illness, and as most know, viruses, there is really no good treatment for viral illnesses. There are very few medications that specifically target and kill viruses, unlike antibiotics do for bacterial illness. Now, having said that, when you have any viral illness, what you would do is treat the symptoms. Tylenol is probably the best medication for the symptoms of COVID, just because, like any viral illness, you have aches and you'll have fever, and Tylenol or acetaminophen will help relieve some of those symptoms. And then the things that our moms and our grandmas always taught us: a lot of rest, a lot of fluids, those sorts of symptomatic treatments.
When we talk about how contagious COVID-19 is it as contagious as the measles?
No, it is not. The measles virus it's a much smaller viral particle. It's more easily aerosolized. That means it's hanging around in the air for a long time. And COVID is it's much closer in size and activity than the flu virus. Maybe a little bit more infective than the flu virus, but the measles virus is probably 3 to 4 to 5 times as infectious as the COVID virus that causes COVID-19.
The city of Laredo recently made a requirement that people who are going out, whether they're sick or not, should be wearing a face mask. Again, even if they're not sick. The next question is, should I be wearing a face mask even if I'm not sick?
So the reason In the community, if you stay, the 6 feet apart, then there's really no reason to wear a mask. Okay, the mask, if you are ill, then that mask may help prevent you from spreading droplets. But again, if you're 6 feet away, you're not going to get those droplets on anyone. And the same thing, if you're around someone that's sick, a mask may help you not get any of those droplets in your system, but staying 6 feet apart is much more effective.
Can this virus be spread through currency, through money?
So this virus, like almost any other virus, can exist on inanimate objects like money, like pens, like doorknobs. The real question is, and it's hard to ever answer this question, is how long does it stay there, and is it there in enough quantity to actually cause an infection? Is there enough viral particles there for a long enough period of time to come and cause an infection when I touch that dollar bill? It's probably very unlikely, but
yeah, okay.
Certainly is possible.
I always like to give you the last word in all of this. What do you want our viewers to take home with them tonight from this segment?
I think once again, I want to stress the importance of social distancing and staying at home. I know this is tough, but we still have, several more weeks of this battle, and staying home is the single most important thing to do. And that means really not congregating together, not going out on the basketball court and gathering around together. That's a very easy way to spread the virus. And it's thought that, if someone has an infection, first of all, they might not know it right away and still be spreading. But for every person that has the infection, they spread it to 2 or 3 other people, and then that web just starts growing. So stay at home, maintain the social distances.
I also want to put up the website for your particular group. Dr. Frolichstein, here it is, gsepem.com. We talked about it at 6 o'clock. But if somebody doesn't have a primary care physician or somebody that they can do telemedicine with or ask questions to, this is one of the many resources that are out there, correct?
Yes, sir, it is. And we'd be happy to talk to you, answer your questions, really aimed at should you go to the hospital. We're starting to see people not come to the hospital when we think they probably should be coming to the hospital. And so we want to help you answer that question. It certainly is safe to go to the hospital should you need to. We're very careful about protecting patients that are not at risk of COVID or we don't think they have COVID. So it's very safe. If you need to be there, please come. We can help you figure that out via telemedicine.
Dr. Robert A. Frolichstein from Emergency Room Doctor. That's his group right there from Methodist. Thank you very much for your time. We'll see you next week.
My pleasure. Thank you.
All right, we'll be right back.